Hi, I'm James the Osteopath, and today I'm going to teach you how we're going to fix your back pain that is right in the centre of the back and even radiating out round to the side. Now, from treating hundreds, even thousands of patients, we know that we can boil it down to a few obvious causes of back pain, which basically means we know what's going on with your back without even having an assessment. Very often, the symptoms that you're getting are going to be coming from tightness in the muscle all around through the side, and also restriction and degeneration in the spine, the discs, and the joints. So these two things, if we can address them with you, you're going to start feeling and moving so much better. So let's get started. So the only thing you're going to need is some sort of ball. Now, anything this kind of size that's relatively firm but not too hard, and I want you to lie on your back with your knees up in this position. If you've got your knees up, you're flattening off your lower back, and then place the ball that you've got underneath your back but not under your spine. Bring it off to the side slightly so it's under all the muscle on the side of the spine here. So you place it there and then you roll back on top of it. Now you should be able to feel this pressing into the muscle that you're lying it on, and then bring one knee up and hug here. This further flattens off your lower back and stretches all the muscle here. And as I'm pulling, I can feel the pressure increasing deep into that muscle there on the ball. Now it's actually quite painful, which is a good thing because it shows the muscle is so tight that that pressure deep in there is pressing in and it's super tender. So you hold this for 30 seconds, and then once you've done that for 30 seconds, I want you to roll to the side, move this ball slightly up or slightly down depending on where it already is, move back over and then pull the knee up again. And again, you can feel the pressure and pain increasing in the area as you do that. Now, again, you can do that 2, 3, 4 times all on one side. If you've only got back pain on this right-hand side, then just do it on the right side. If you get back pain on both sides, of course, you're going to want to switch that to the other side and do the knee hug on the other side. Now, once you've done that for a good 3, 4 times, all on the painful side or both sides, you're going to then want to increase the movement that we're getting through the joints, because we've spoken about with this exercise how to release the tightness through all the muscle here. The next thing we need to do is increase the movement through all the joints. Now this exercise is very similar, but rather than using a ball and pulling a knee up, I want you to do this. I want you to lie on your back, have one leg straight, this knee up, and pull diagonally over the body here, keeping your shoulders flat. As you do that, you can feel your spine rotating over like this. Hold for 30 seconds, and then again, other side, put across the body and hold for 30 seconds here. So that is one way to increase rotation through the spine. We also definitely need to increase movement through the sagittal plane, the forward and back movement. So to do that, it's a simple one, hands and knees like this. And then what I want you to do is to push your back all the way up into the air. As you do this, draw your stomach in and pull your spine up like that. Hold at the top and then drop all the way down. When you drop down, keep your arms straight. It's tempting for people to bend their arms, but you must keep your arms straight as you drop your back down to there. And then again, you're going to go all the way up, push, 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 high at the top, drawing your stomach in, and then arching all the way down. Now you will see that we're working at two major movements here. That second movement, the cat stretch, is a flexion extension, which is the sagittal plane. The first exercise where you're lying on your back and you're pulling a knee across the body is rotation of the back. So we're rotating and we're going forwards and backwards. That's sufficient to increase the movement through your spine, which really helps the joints and the discs. And then of course we had the exercise where you've got the little ball underneath the lower back. Remember, it's not on the spine, it's to the side. And as you pull that knee up, it flattens off the lower back so that you're really increasing that pressure deep into the muscle there. If you do that, you can release the muscle, improve the movement through the spine. And those are the two major things that if you can nail and get totally sorted with your back, you're going to start feeling and moving a lot better. Of course, there's more to be watched, there's more to be done, there's more exercises to do, and you can see those on my other videos there and there, or go to my profile page. But really, if you can just nail these and focus on these 2, 3 exercises for now, you will start feeling and moving so much better.